Rotarian Dorothy Dix and her husband Michael founded Creating Better Futures in 2012. So, Dorothy, when did you join Rotary?
I joined Rotary in 2014, in April 2014, as a member of the Rotary Club of Reading Matins based in Reading. And I was a member there for a number of years, which was a great club. And because of family commitments, I'm now a member of the Thames Valley Rotary Club.
So tell me about your Rotary journey and how did it change your life?
So I have known about Rotary ever since I started going to school. I was born and raised in Zimbabwe, born to a single mom who couldn't afford to look after me herself. So she needed her family and also Rotary support, and was able to help me access literacy programs, vaccinations, and sanitation programs that were run at schools in Zimbabwe. And Rotary then helped me to get my first scholarship at the age of 16 to study at the United World College in Norway. Rotary also inspired and supported me to win a young speakers competition where I got to speak at the United Nations in New York about the importance of education for girls in Africa. And then Rotary brought me to Reading through my scholarship to study at the University of Reading that was part funded by Rotary and by the United World Colleges. So Rotary completely changed my life through the different opportunities that it gave me.
Tell me a little bit about Creating Better Futures. I know you run it from Reading.
Yes, Creating Better Futures is based in Reading. We set it up with my husband Michael, with the help of friends from our church, and we wanted to give back the gift of education that Rotary gave to me. And we thought, even if we started off with just one child that we could support, then that would mean that we have at least changed that one life. But 8 years later now, we have 5,135 orphans and vulnerable children that we support at different rural schools in Zimbabwe. We support them through programs like education, child health and well-being, sanitation and hygiene, women and girl empowerment programs, community and economic development projects.
So now, of course, the pressing issue of the day is coronavirus. Tell me, how is this affecting the people of Zimbabwe?
Yes, so coronavirus has impacted many lives throughout the world. And the impact is exacerbated in Zimbabwe by a lot of different factors. The biggest factor at the moment is the poverty and vulnerability of the people. Because of the economic and political instability of this country, many people are unemployed and have been struggling already before the coronavirus impact. They had already been struggling to make ends meet, with a lot of families earning less than $1 a day. Vulnerability is through the fact that a lot of people are not in good health conditions at the moment. A lot of people have already been suffering through malnutrition, through lack of medical facilities that are already overwhelmed. So it has really made the impact of the virus, one, very difficult to prevent the spread of it, and also the lack of information from the authorities about how many people are infected and how many people have died from it is of concern. The reason why the numbers are very different depending on who you speak to is because there is a big shortage of personal protective equipment that staff can use working in the hospitals and medical facilities. There are also not many testing centers, and people are not aware of where to go and get a test. And in some cases, even if they show the symptoms, they can't afford to travel to a testing center. Also, treatment places are overwhelmed. there is lack of medication and lack of oxygen and breathing materials and facilities that can be used. There are no ventilators in a lot of the hospitals. There are only very few and far between, and it's mainly people that can afford to get admitted into a hospital that can access such treatment. There is also a huge prevalence of underlying diseases, some of which are undiagnosed or untreated. The reason why the children that we help are orphans is because they would have lost one or both parents to AIDS and HIV. And so that is a prevalent underlying disease that has made the number of people dying from coronavirus increase. There is also a lack of understanding and awareness of social distancing because people can't afford to work from home. They're traders, they have to go out to the market, they have to deal with their customers on a daily basis for them to be able to live. So a lot of people are taking the risk, going to crowded places just so that they can earn enough to feed their children at home.
Now, the life of the children is obviously very different there to the way that it is here, not least of which is they rely greatly on being fed at the schools. Tell me a little bit about the life of children.
Yes, so like I mentioned before, we feed 5,135 children across 10 different schools. Now, school is the one place where these children have been guaranteed to get 2 meals a day, one of porridge in the morning and another one of a nutritious drink called mahel in the afternoon before they go home. And this, since we started the feeding program, this has been a lifeline for a lot of children that were suffering from hunger and malnutrition. Now that schools are closed and the country's in lockdown, these children have no guarantee of where their next meal will come from. And being orphans and vulnerable children means that they're an extra mouth to feed for an extended family that's been kind enough to look after them, or for an elderly grandmother, a guardian that can't work and hasn't got the money to be able to support them. So children are going hungry. In the country, it is estimated that 5.5 million people face hunger and starvation. The rainy season has not been good and the harvest has been poor, so a lot of people need that help. And the most vulnerable in that case are children. Most children are then forced to go out onto the streets, to scavenge for food, to beg, to look for any means and ways that they can earn a little bit of money if they are the only one that is physically capable of doing that within the home. And this makes them vulnerable to neglect, to abuse, and to exploitation. And also, more importantly, vulnerable to catching the virus and then transmitting it to those elderly guardians and relatives that they live with that might have underlying conditions which makes it a deadly situation for both the children and their caregivers. There is also a lack of safe, clean drinking water within the communities, which the children would have had access to at the schools, and lack of hand washing and hygiene, sanitation facilities that they would have had at school, such as toilets, such as taps to wash their hands and soap. So all these things that they would have had at school, they don't have at home. And so being at home provides so many different challenges that these children are navigating through on a daily basis. And Creating Better Futures has been looking at different ways that we can address this situation and help the children while they're at home.
So how can we help you to help the children?
You can help us by joining our appeal, and it is on our website. If you look for Creating Better Futures COVID-19 appeal, there is a lot of information on our website with regards to the aims of the appeal and also with regards to what we have been able to do so far. So far, we have distributed food parcels to nearly 400 children. But like I said, that's just nearly a tenth of all the children that need our help and support. So the food parcels are critical for us to keep supporting these children while they're at home. And also, when they're at school, we're looking at a situation where we're feeding one child, but when they're at home, they might have cousins and other cousins and family members that will also need that support. So £50 will feed a family of 3 for a month. And we're seeing this as a way of being able to keep them well fed while they're at home. We're also sending out information. It's very different from here, where we have internet access and we can look up the latest statistics or the latest information on coronavirus. Out there, people don't have internet access in these rural areas, and they're not being given enough information to know anything about the virus itself and how to prevent its spread. So what we have done as a charity is that we have translated some simple flyers from English to Shona, which is the local language, where we explain it very simply on how people can prevent the spread of the virus, what the symptoms are, and also what they can do to stop spreading it and catching it. So that's been really eye-opening for a lot of the communities where they just did not have this information to hand. So through raising awareness, we are helping to prevent and to protect and also to educate the community. We are also looking at a lot of different empowerment programs that we're doing, where women and girls that are usually the most victims in situations where there is a crisis. These are women that we are empowering through the production of reusable sanitary products that they can have to use while they're at home. And we're also looking at post-COVID-19 planning in terms of how the education of the children can be continued, and through sustainable farming projects, how they can be trained to grow their own food much more sustainably.
Thank you so much. There's an awful lot there to take in, but I do hope that Rotary, District 1090, and hopefully Rotary in a much wider field can help you to help the children. Dorothy, thank you so much. Thank you.
Thank you very much for having me.